Again, we're a little behind. Okay? So, the topic here is about blood and marrow transplant, and it is basically about the transfusion of stem cells from a donor, that what we call allogeneic, or stem cells from the patient himself, that's what we call autologous. So basically, some people might think that it's a transplant you get from one organ transfer to another. No, it's basically an infusion. It's in liquid state, right? So it is not really an operation, but more similar to a blood transfusion because you're using something that's liquid, right? So just to settle that confusion sometimes. You may not be able to see this, but it just shows you that everything comes from the stem cell that you can see on the left side of the screen, and it gives rise to the different types of blood cells that you can see on the right side of the screen. Okay, so this is not a medical lecture, I will not go into this. Alright, so if a bone marrow is required, this was the trend or the way it was done many years ago. So it's 70s and the 80s. So the patient would be actually in the operating room, and the bone marrow is harvested from the pelvic bones, the hip bones. Okay, so bone marrow is extracted over several areas of the bone. So there's anesthesia involved. Of course, there's some pain involved after the procedure. This is, sorry, no one's eating yet, I hope. Okay. This is the placenta, and that's the attached umbilical cord. So that's where the cord blood can be obtained. Does not cause pain to the mom. That does not cause pain to the baby. Okay, because it's collected after the baby is delivered. So there should be no problem with that. And then there's another way of collecting stem cells from the circulating blood. So there's a needle inserted into a large vein, and then the blood goes through a machine, and the machine collects the stem cells that are needed. That's a more recent way of collecting stem cells. Okay, so basically three options: bone marrow, peripheral or circulating blood, and cord blood. Obviously, the easiest is cord blood. Again, there are two types of donors. One is allogeneic, and one is autologous. Allogeneic means there is a donor who could be a sibling, who could be unrelated, meaning anyone in the community who matches, or a cord blood from someone else. Autologous, on the other hand, means there's no donor, but the stem cells come from the patient himself or herself. This is the typing I was telling you earlier. It's not a simple ABO match. It's not a blood type that we're looking. It's the HLA match, which is more complex. Okay? And there are two types of transplants, depending again on the type of donor. One is autologous, one is allogeneic. In an autologous transplant, chemotherapy is given to remove all the cancer cells, like in leukemia, and then the stem cells from a healthy donor is given to that patient in order to replace the bone marrow that has a disease. Okay? On the other hand, autologous means from the patient himself. Allogeneic means that it's coming from a healthy person, and it will have the effect of what we call graft versus leukemia. The healthy donor stem cells can go in, and the lymphocytes can go in to fight the leukemia of the patient. Okay? So that's the added benefit of an allogeneic transplant. So just to give you an idea, as I know that there are medical doctors here as well, the procedure in allogeneic transplant involves basically giving total body irradiation. It may or may not be given, meaning there's radiation that's given to kill off the diseased bone marrow in that patient. So that's the irradiation that you see here. And then given some medications to kill off the tumor. And then the stem cells are infused from a healthy donor to the patient, and other medications are given. So that's the general way it is done. The -8 here, the signs on the left are the days before the actual transplant. Okay? Before and after. So for example, that's total body irradiation. So radiotherapy is given to destroy the bone marrow cells. And then the bone marrow is collected from a donor and given to a patient. That's Dr. Racho there wearing the white coat, and you will see him later on. And then here's the patient. The patient can be in the other room. So the stem cells are collected from a healthy donor and given to the patient in the next room. Okay, so it looks like a blood bag, but this one contains stem cells instead. And then you expect that the WBC, that the patient cannot make his own blood cells because remember, you gave high dose irradiation, right? So you expect the white cells of the patient to go down and then later on it will go up after giving the transplant. And you can just imagine a patient without his own blood cells trying to fight off infections. So infection is a major issue here because they are very, very prone to having infections. Okay, on the other hand, in an autologous transplant, meaning you don't have a donor, the stem cells are coming from the patient himself. Okay, so the patient is given medications and then given GCSF. This is a medication that will help the bone marrow to release stem cells into the circulating blood. And then it's collected using the apheresis machine, the machine that I showed you earlier. So that's the way it's done now in most centers. So this is the collected blood from the patient, his own stem cells. It's processed in the laboratory. And then we put in some solutions in order to preserve it. And then the patient will again be given irradiation, some medications, and then on day 0, that's what we call day 0, like ground 0, okay? That's when we infuse the stem cells and again support the patient over the next several weeks in the hospital in a very clean environment. Okay? So that's how it is given. It's given through a large vein, usually in the groin, and then it's infused directly. Okay, so again, it looks just like a blood transfusion, but what is given here is a very rich concentration of stem cells. Okay, so again, you can